So how do you investigate it? Yes, full blood counts, but the diagnostic, what we call the major index for diagnosis is culture using blood agar with um, Loeffler and Tellurite. So once the pseudomembrane is scraped, it is cultured in blood agar, Tellurite, and Loeffler. Management, there's a supportive care which you give. If a patient's oxygen saturation is low, you give oxygen. Patient may require fluid, some may require bed rest, humidification. Antibiotics is very important. The appropriate antibiotics are the penicillin group. Antitoxins can be given, and in this case, the antitoxin is given either 10,000 to 100,000 international units, depending on the severity of the condition. Systemic steroids are useful, have been found to be very useful in managing diphtheria. Very importantly is the use of airway management. Because of airway compromise, patient may actually require airway management by way of endotracheal intubation or tracheostomy, as the case may be. Some patients may also require bronchogenic removal of the pseudomembrane. You do bronchoscopy and you do a scraping of the pseudomembrane from the tracheobronchial tree. Also, booster vaccination may be needed in certain cases, and this is usually given during the recovery phase of patients. Importantly, in preventing diphtheria, it's important for the childhood immunization program to be adhered strictly to. We have the DPT1. DPT1 is given at 6 weeks, DPT2, 10th week, while DPT3 given at 14 weeks. So all this child immunization program should be strictly adhered to. Then also training and retraining of staff, health education is very important in coordinates, just like I am doing now, health education, educating the populace. There are so many channels online where people get educated, so many. Is it Aproko doctor? You get to listen to him where he educates people on general hygiene, general do's and don'ts about health, or Dr. Fredos, a lot of people online, Dr. Truths, and so many of them like that online. So there you get to learn more about the do's and don'ts of some of these communicable diseases. That is very, very important. By and large, the important thing is that we do not want the condition or the infection to get into very, very severe state whereby prognosis become poor. The indices for poor prognosis are myocarditis, neuronitis, and then of course acute tubular necrosis. We don't want it to get, once it's at that stage, it's usually very difficult to manage. However, with sore throat, once you have sore throat persisting for 2 or 3 days, not resolving on regular medication, there need to be high index of suspicion that this may be diphtheria, because currently in Nigeria there's still being reported cases of this diphtheria all over the country, and in some other parts of Africa and of course Southeast Asia axis. So it's important to know that yes, diphtheria exists, and it has both throat presentation or throat manifestation. It has laryngeal presentation. It can affect the heart, can affect the kidneys, can affect the skin, can affect the genitalia. Well, thank you very much for finding time to join me on live. If you have any comments, you can put it below. Do try and share this live video with some other persons who may need it. Thank you. Bye-bye.